Hello, Patho class. My name is Haley Seeley, and I am going to talk to you about amyotrophic lateral sclerosis, also known as ALS and referred to as Lou Gehrig's disease. When you break down these three words here, A means no, myo means muscle, and trophic means nourishment, and lateral refers to the area in the spinal cord where the nerve cells that signal and control muscles can be found in the body. ALS causes this lateral area to regress or degenerate. This degeneration leads to scarring in this region, which is where the term sclerosis comes from. So what exactly is ALS? It is a progressive neurodegenerative disease involving the nerve cells that are responsible for controlling our voluntary muscle movement. Progressive meaning that the symptoms worsen over time. These voluntary muscle movements include chewing, talking, walking, breathing, and more. ALS affects the motor neurons, and these neurons are cells that expand from the brain to the spinal cord and the muscles throughout the body. These cells provide important integrating communication between the brain and voluntary muscles. Unfortunately, this disease is 100% fatal, so there is no cure or survival outcome. There are two types of ALS. Sporadic ALS is when there is no family history of the disease, and it's the most common type. Familial ALS is when the disease is inherited from someone in the family history, and both of these types of ALS can stem from genetic causes. As you can see in the picture on the right, the left side of the picture shows normal skeletal muscle, and the right side shows wasted away skeletal muscle that you would see in someone with ALS. The cause of ALS is not completely known, but researchers have found that it's multifactorial, meaning there are genetic and environmental influences. ALS is most commonly caused by a gene mutation, and there are different causes for sporadic and familial types. Sporadic is mostly caused by environmental factors, while familial is mostly genetic factors. Sporadic causes include oxidative stress, which is when the production of free radicals and the body's ability to rid of their harmful effects is imbalanced, mitochondrial dysfunction, abnormalities in the immune system, glutamate toxicity, which is when glutamate accumulates around the nerve cell, and toxic exposures. Familial causes are a mutation of the SOD1 gene, and it's not exactly clear on how this gene is linked to motor neuron degeneration, but it is implicated in apoptosis and ALS. The TDP43 gene, which is a cardinal protein in ALS, and ubiquinol 2 protein, which plays an important role in the regulation of protein degradation. Overall, the main cause of ALS that has been found so far is cellular defects that can lead to motor neuron degeneration in ALS because the shape and size of the motor neurons is mutated. The symptoms of ALS can vary from person to person as well as progression. For example, one person might have trouble gripping a pen or lifting a coffee cup, or someone else might have trouble with their change in vocal pitch while speaking. ALS has a gradual onset, and the most common symptom is progressive muscle weakness due to atrophy of the muscles. This begins in the muscles that control speech and swallowing, or muscles in the hands, arms, legs, or feet. More common symptoms include fasciculation, which is persistent muscle twitches, spasticity, shortness of breath, the muscles eventually become paralyzed, and there can be some cognitive impairment. It is important to remember that only the motor neurons are affected, so the person's sight, hearing, taste, and smell are not affected. The picture to the right shows the upper motor neurons, which are in the brain, and the lower motor neurons, which are in the spinal cord and brainstem. The upper neurons normally send signals to the lower, which then send signals to the muscles, but with ALS, these neurons are lost. Diagnosing ALS is a difficult process, so there are often many different tests used. Many of these tests are used to rule out other diseases similar to ALS. Tests include an EMG, which is an electromyography, and detects the electrical activity of muscle fibers, a nerve conduction velocity, which measures electrical activity of the nerves and muscles and the nerve's ability to send signals, a blood and urine test. These are used to mostly rule out other disorders, a spinal tap, which is to test the fluid surrounding the spinal cord, X-rays and MRIs, a myelogram of the cervical spine, which uses X-rays and special dyes, muscles and/or nerve biopsy, and a neurological exam. Pictures on the right are two of the most common diagnostic tests used for ALS. When it comes to treating ALS, there is no cure and no effective treatment that can stop or reverse the progression of this disease, but there are medications to help with symptoms. These medications can also help with pain, depression, sleep, and constipation. One common drug used is riluzole, also known as Rilutech, and it reduces the motor neuron damage by decreasing the level of glutamate. Another common drug is edaravone, also known as Radicava, and it helps with the decline in the clinical assessment of daily function. Other treatments include physical and speech therapies, as well as nutritional and breathing support. Risk factors for ALS include age, because the symptoms develop mostly between age 55 and 75, although the disease can come at any age. Gender, because men are slightly more likely to get it. Race, because it's more commonly seen in Caucasians and non-Hispanics. Ethnicity, genetics, it can be hereditary, and 10% of people with ALS inherited it. Smoking can be a risk factor, as well as environmental toxic exposure, and military service. Military service is a risk factor because of possible exposure to certain metals or chemicals, traumatic injuries, viral infections, and intense exercise. Military veterans are twice as likely to get ALS. There are many complications that come with having ALS. Breathing is a big complication because over time, ALS paralyzes the muscles used for breathing. This may cause someone to need assistance breathing, possibly from a machine. The most common cause of death for people with ALS is respiratory failure. Speaking problems occur due to the muscle atrophy. There can be problems with eating due to the damage of the muscles that help with swallowing. When these muscles don't work properly, it can cause choking, malnutrition due to not being able to eat, dehydration, and pneumonia due to food, liquid, or saliva getting in the lungs. A feeding tube can reduce these eating complications from happening. Dementia is another complication that causes problems with memory and making decisions. Some people with ALS are eventually diagnosed with frontotemporal dementia. Bed sores can also be an issue due to the inability of movement. Because the cause of ALS isn't completely known, preventative methods can be hard to come by. Some prevention methods do include removing as much toxins from the environment as possible and adopting a healthy lifestyle, which includes diet and not smoking. This is Coach Keenan, and he is from my hometown of Chillicothe. He was diagnosed with ALS at 40 years old and passed away at 46 years old last December. The normal survival time after finding out you have ALS is 3 to 5 years, but he lived 6. You can see a small difference in the two pictures, and you can also see that he is unable to walk. Here are my sources for Professor Eddie, and thank you for listening.